Greetings, Dr. Mark Winton here from the University of Central Florida Department of Criminal Justice, and in this video I'd like to go over a few things related to interviewing and de-escalation skills. First, I wanted to mention that usually one's place of employment will have specific procedures to follow in these types of cases, and also one would be trained. And so you would have procedures or protocols that you would follow for a variety of scenarios. And of course, I'd recommend that you follow those. And also, of course, the first thing that one would have to do is to assess the risk and decrease or remove any immediate risk for the safety of all those involved. So obviously, there would have to be that taken care of before we get into interviewing skills. And so what I'd like to also mention is that reading and viewing videos regarding these skills is very important, but I recommend frequently practicing these skills. Maybe role-playing with others, recording yourself, obtaining critiques of your interactions, looking at other options, looking at what went really well, what can be improved upon. And also, if you have these skills, then the great thing is you can mentor others. And so these come with practice. And I think really, the best scenario is getting out there in the field and practicing. The more you practice, like any other skill, you become better. And the more scenarios that you're exposed to, you begin to look at some options as well. So there's a variety of skills that you will have. And sometimes I conducted several thousand interviews in my career. And what I found to be very helpful is to have that interest in the person, have an interest in helping that person, showing the person respect as well. The last thing I would want to do is to be arrogant or cocky. People will pick up on that right away, and that closes communication down. And I've seen situations where that occurs, and it's something that someone can work on if they come across that way, if you will. And that's why it's so important to gain the feedback and understand. So I went through intense training and was supervised and then conducted interviews and then later trained people on interviewing. And of course, you're going to see other special factors that come into play. For example, if you're interacting with someone with an intellectual or developmental disability, that you may apply some different skills for that scenario. You may apply some different skills if you're, interviewing, trying to de-escalate a situation involving children or involving adolescents. Cultural factors may come into play as well. Age factors, that with an aging population and seeing higher rates of dementia, that we need to have an understanding on how to make quick determinations if someone needs additional medical care or at risk. I certainly learned early on how that all works and doesn't work. And so, along the way, we're going to learn a lot, and we're going to see how these skills can help. But building rapport with the person is very important. And one way that we do that is through active listening. Listen, 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 and talk only when needed. Listening is a skill that's very important to acquire, that we're able to obtain information, and when we're actively listening and showing the person that we're interested in their story, we're showing support, we're also showing an interest, we're showing respect. So those are very important. And reflecting what the person is saying so we understand what they're communicating to us. I'm not saying it has to be rational and make sense, but we want to understand where they're coming from. So active listening, reflecting, probing for other information, for clarification, and to further gain information about their situation. We want to avoid getting into verbal conflicts. That can escalate quite quickly. I've seen a lot of conflicts occur. Actually, my first exposure, really, I think, to conflicts, besides the conflicts I saw with childhood and adolescent, when I was a child and saw conflict, and adolescent and saw conflict, but really, when I was in undergraduate, I worked in a nightclub, and I saw conflict occur, later on in the nights, barroom brawls, if you will, and I would watch carefully. Sometimes I would tell the bouncer, I think you're going to have a physical confrontation occur between those people over there. So you should actually just remove him now. And that's kind of a weird thing. That, like that Tom Cruise movie where you're predicting crime before it occurs. And so obviously he would keep an eye out and try to intervene right away if he saw things were escalating. Tell the people, you guys either need to leave or you need to go to separate corners or separate areas of the nightclub, etc. But so a lot of that's going to be your observational skills as well. Realizing that we make mistakes all the time, and we may, bring in our own biases as well when we observe different behaviors, trying to figure out what's going on. But practicing our observational skills is real important. Hearing the story in a non-judgmental way. And sometimes that can be hard to do in some situations. But if you communicate that non-judgmental aspect, that will open up for a greater exchange of information. Try to find out what they're experiencing, how they're feeling about it, what's going on, what they need. I can tell you that sometimes someone will come in for an interview, and I said, well, what's going on? What's up? And I might get 20 minutes right there. And that brings me to the next aspect. You must take your time and go slow and be patient. And I know that can be a situation that may be problematic if you're trying to do 4 or 5 different things and multitask in an impossible way. If you can't take the adequate time, that can lead to less understanding of the situation, and then looking at the options of what to do. So, of course, you want to be kind and respectful. I think I stated that already. And you want to create a safer environment for that person as well, and also provide information as appropriate. I sometimes think collaborating on problem solving is helpful, because you're kind of understanding where they're coming from, but also understanding some of these options that might be out there. And doing all this with a low, calm voice. I can't emphasize that enough. I can tell you I have to be very careful. And one of my big problems that has been difficult for me to deal with is I have a hearing impairment. I wear hearing aids most of the time. I should be wearing them when I'm interacting with people. I probably was very much, reading lips for many, many years. I didn't know I had a hearing deficit till my spouse, who worked in the medical field, had me come into her office. They tested me, and they then sent me to audiologists, found I had major hearing loss. And so I got hearing aids, and I never knew, I had never heard the sound of a hard drive before on my computer, and my car made all kinds of strange noises. But one of the problems was not only not hearing sometimes what people said and trying to figure out what they said, but also talking loud. And I still have that problem. And even when I'm on the phone, sometimes I'll stop and I'll say, excuse me, please let me know if I'm talking loud, and I'll tone my voice down somewhat. And so I try to be more conscious of this, but it may sound like I'm agitated or yelling when I'm just talking in what to me is my normal speaking voice, which is loud. And so I've become more aware of that as well. Be aware of your body language. That communicates a lot. Okay, tell me what's going on. Looking at your watch, trying to figure out how long it's going. Something like that. Clearly, then, hey, what's going on? And you need to learn how to have appropriate eye contact, and the distance to keep is going to depend on the situation. Again, refer to your strategies and protocols in your agency about all that. Um, and the ideal situation is to have support systems available right away or as soon as possible. That's an important situation as well. And look for natural occurring support systems. That may be a family member that it can help or assist, or they may ask for a family member, or they may have problems communicating and need a family member, or there may need to be an interpreter or something of that nature. So you're doing a lot, really. You're trying to problem solve, but if you can keep that demeanor and that interaction going, I think also that helps you to look at other options as well. Um, of course, you have to do that danger threat assessment in regards to, is that person a threat to themselves or others, and that's a whole nother issue that you should be trained in regarding, for example, Baker acting, people who are at risk to themselves or others. Also, you always want to consider if a medical crisis is going along as well, and obviously substance use may be an issue. So there's so much going on, in doing all this and interviewing and de-escalating. Actually, I see the interviewing process as part of the de-escalation process. That's how I view it, at least. And of course, allow the person to vent as well. And sometimes there may be a little antagonistic toward you verbally, and I would just say go with that, and try to reflect they're very frustrated and angry, and let's try to figure, you want to understand what's going on, figure out what's going on. So I can tell you I practice this a lot. Sometimes I don't, and in just my daily interactions, or if I'm on the phone or talking to someone, and I have to remind myself, when I'm not in the field, for example, when I worked as a professional conducting interviews, I basically put myself in that role. So I could have a really bad morning, and then I go in to the clinic and I put all that aside behind me temporarily and focus on what's going on with the person. Because if you're distracted thinking about other things, they'll pick up on that possibly, and that can lead to gaining less information and things of that nature. So there's really, again, I'm just giving you some general ideas here. In your textbook, there's a section in chapter 7, pages 185 to 189 on de-escalating strategies and interviewing people in a mental health crisis situation. I've also posted in our course a short manual on helping people in mental health crisis. And so there's a lot of materials, of course, you can read, a lot of videos to watch. I always say look at what went right in cases and look at also what went wrong. Some people were asking me about a case that had a negative outcome. And I wasn't quite sure if there was anything else that could be done that led to that negative outcome. It seemed that the law enforcement officers followed what we would expect them to do, precisely what they had been trained to do. And it was just a bad outcome. And so we look back on that and say, well, were there other options? And there may have been some possibilities. Doesn't necessarily mean that mistakes were made or that procedures weren't followed. It means that we may need to reassess if there's other options in certain situations, or what happened. And in other times we can see it building, like, okay, we see that instead of de-escalating a situation, we see someone escalate a situation. One of the things, if you become an expert on de-escalation, you're also probably going to have the knowledge on escalating situations. So, that's something to consider as well. But again, practice, practice, practice. I think that really is, where it's at. And if I was very fortunate when I started my work, I had no clue what I was doing, but I had amazing mentors that guided me and that assisted me and that helped me. I still remember the first interview I did for the court system. I was just nervous as can be, wondering, how am I going to mess this up? How am I going to mess this up? How am I going to mess this up? And it's videotaped and it's given to the prosecutor and all that. And I remember going into that interviewing room thinking, I'm just going to listen. I'm going to listen. I'm going to just go in there, greet the person, introduce myself, and ask them what's going on. And that's what I did. And the person, 15 minutes, exactly what had happened. And people are like, wow, that was really a good interview. And I'm thinking, I didn't really do anything. Well, I did. And that was, I let the person talk. I didn't interrupt. I showed respect. I tried to communicate empathy. I tried to build rapport. I let them tell their story. I tried to understand what was going on. And so, you see that some situations. And again, experience is very important as well. And so I consider myself, after 40 plus years of doing this stuff, still learning, still reading the literature, still trying to improve myself in my communication skills. So this, I'll wrap this video up now, and hope that, of course, you can integrate this with all the other materials that are available in practicing and mentorship. Thank you.